around and everyone's, got this concept of connectivity. Everyone gets it. You've got Facebook, you've got Twitter, you've got LinkedIn, you have your iPhone, your iPad, your iThis, your iThat. You have your Blackberries. Everyone seems to get this connection. So the thing that you want to ask your neighbor is, do you understand how important connectivity is? One thing we knew for certain was that the only way that Full Circle would ever be what it had the potential to be was if people were willing to collaborate. And knowing that we were in the South, the Bible Belt of the South, the buckle of the Bible Belt, no less, we knew that the best place to start would be where the hearts of the people were. And for us, it just made sense to start at the church. So one small test of our potential was that one of the first projects for Full Circle was actually to develop a women's health survey to pass out at Mount Zion. We wanted to see if the report card from 2009 adequately reflected the population that we were serving. We wanted to see also, though, on the flip side, if there were sort of any glaring issues or topics that may arise that weren't necessarily captured by that report card. And if there were, we obviously needed to know. And this was actually done in collaboration with the Department of Public Health with some of their summer interns. And we decided that we would pass out this survey on a Sunday morning. And I don't know if many of you know, but given the size of Mount Zion, we actually have 4 services on Sunday. But before we pass out these surveys, I stood up in front of the congregation and spoke to the women and told them the results of the report card and really challenged them. I challenged them to be part of the solution. I challenged them to let us know how we could better help them. Well, in about 5 to 6 hours, basically after all 4 services, we had collected over 3,200 completed survey results. 3,200. And yes, many of the survey results pointed to the fact that, indeed, this population that we were dealing with was consistent with the rest of the state. But having said that, it also pointed to the fact that the population needed guidance. Many of these women had no idea that their health was at significant risk. And when we brought the results back to the church, Bishop Walker decided that Mount Zion would partner and continue to partner with Full Circle, along with other community partners, including Marathon Fitness and Eddie George and David Thornton from the Tennessee Titans, as well as other exercise trainers from the community. And we launched a church-wide healthy lifestyle, healthy living initiative called ChurchFit. ChurchFit is a faith-based approach to holistic health, focusing on strengthening the mind, the body, and the soul. And for ChurchFit, we developed a few programs, one of which was church-wide workout. So basically, once a quarter, we would encourage everyone to come out and work out with us together. But what we were doing was we were hoping and praying that other people were as excited about working out as we were. And we were thinking that maybe we would get 100, 200 people to come out and work out with us, 500 people tops. Well, on that Sunday morning, over 1,000 people came out to work out with us. We had people from all ages. We had kids working out in one area. We had senior citizens working out in another area. We had adults working out in the main area. We brought in instructors to teach yoga and Zumba, for goodness sakes. We brought in instructors to teach aerobics and strength training. It was just an awesome, awesome event. But we also recognize that in between times, not everyone could actually afford to hire a trainer, and not everyone can actually afford to join a gym or get a gym membership. So we actually decided that we would provide free weekly aerobics classes to anyone who was interested. But in addition, we also recognize that yes, exercise is important, but it's only half of what it takes to get you to the place of good health. So we decided to also hold health education classes throughout the week. And we give classes on a whole range of topics, from nutrition to HIV prevention to reproductive health. And there's actually a number of people who are in this room who have come in and give us talks or lectures, and then there's others who are on the board to continue to do so. But what we want you to understand is we don't believe in just educating, but we also believe in empowering. We're empowering people to be advocates for their own health. Advocates for the health of not just themselves, but for their families, for their children, for their children's children, in order to move the entire community to a place of better health. We clearly know course, that not everyone in the community goes to Mount Zion. So Full Circle decided to actually figure out a way to bring that information to them. And what we did was actually create an online, easy-to-use community resource locator. You basically go to the Full Circle website, you type in your address, you select a health topic from the drop-down menu, and you push submit. And then a map pops up, and it tells you exactly where you live and all the various resources that are available to you right in your own backyard. And we've only, though, been able to create this tool with the support and the collaboration of students and other people from all over the city. So let's be clear, though, the reason that I'm here is just to encourage us, but also to recognize that although I'm speaking about this particular tool, or this particular church, or this particular organization, these are only one of a number of such entities that are available to us in this community. So here we are, again, we have our report cards in hand. What are you going to do? I mean, one thing that we know for sure is that we must recognize that until we can move beyond crisis and actually feel a call to action and move towards strategic collaborations and deliberate connections, we very well may continue to struggle in these areas that are represented in this report card today. And before I sit down, I just really urge everyone just to look around the room. I mean, we have people in here that are representing every sector. We have people from healthcare, from research, from academia, from education, government. People from the faith-based community are here. People from other nonprofit organizations are here. And we also just have women who are here that are right here from this community. But the bottom line is that I truly believe that many of the solutions to these problems that we're looking at today are right here in this room. Whether they're in you, or the person next to you, or the person behind you, the bottom line is all of us in here have to talk, and we have to strategize, and we have to work together towards moving these grades from being just good to being great. I would also say that in identifying partners to collaborate with, I would encourage us all to just think outside the box a little bit. You know, identify non-traditional partners. Maybe there's an organization or two that you've never partnered with before. Try it. You know, my mom would always tell me when I was growing up, if you always do what you always did, you'll always get what you always got. So just think about that. Think hard about that. You know, you want to identify organizations that actually have their finger or their hand on the pulse of the community. These are the people that you want to bring to the table for discussion. These are the people that you want to bring to the table for solutions. In collaboration, when we work together, that's what makes things happen. And I will actually argue that one of the greatest lessons that we could ever teach our children is that when people come together to work in collaborative efforts in order to positively impact the communities around us, change is inevitable. And so with that, I leave you with one last question. And yeah, you probably guessed it. So what are you going to do? Thank you.